Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will cover multiple choice questions on technique for open extraction of a single rooted tooth. These MCQs are based on our previous video, lecture 4, part 1, where the relevant content has already been discussed. A 45-year-old patient requires the extraction of a single rooted tooth that has resisted closed extraction attempts. What is the first step in the technique for open extraction of this tooth? Ensures adequate visualization and access. The first step in the technique for open extraction of a single rooted tooth is to reflect a sufficiently large mucoperiosteal flap to provide adequate visualization and access. This is an option after the flap is reflected. This is one of the options available after reflecting the flap. This is the final option if other methods fail. This can be done after reflecting the flap. So the correct answer is A. During the open extraction of a single rooted tooth, the surgeon decides to use the straight elevator. What is the recommended technique for using the straight elevator in this scenario? Helps expand the periodontal ligament space. The straight elevator should be inserted into the periodontal ligament space with to and fro motion to help expand the space and facilitate the tooth's removal. Can cause slippage and injury. Small elevators are recommended initially. This is the last option. Placement should be towards the apex. So the correct answer is A. A surgeon is performing an open extraction and decides to proceed with a surgical bone removal. What is the appropriate amount of buccal bone that should be removed? Correct in width but not in vertical dimension. Excessive bone removal, insufficient bone removal. This is the correct approach. The appropriate amount of buccal bone removal is the width of the tooth in a mesio distal direction and 1/2 to 2/3 the length of the tooth root in a vertical direction. A different technique. So the correct answer is D. During the open extraction of a single rooted tooth, the surgeon has reflected the mucoperiosteal flap. Which action should the surgeon consider next to potentially avoid surgical bone removal? Can achieve better mechanical advantage after reflecting the mucoperiosteal flap. The surgeon may consider reseating the extraction forceps under direct visualization to potentially avoid surgical bone removal by achieving a better mechanical advantage. Not the immediate next step. This is done to improve access if needed, but not the next step after reflecting the flap. This is the last option. Another option, but not immediately after reflecting the flap. So the correct answer is A. The surgeon decides to use a burr to remove bone during an open extraction. What additional measure should be taken during this process? Incorrect and can cause overheating. This is done before bone removal. Essential to prevent overheating and ensure visibility during the bone removal process using a bar. It is essential to apply adequate irrigation to prevent overheating and ensure clear visibility. Not related to the bone removal. Incorrect initial step. So the correct answer is C. Consider the necessity of releasing incision in situations involving a single rooted tooth extraction, when is it necessary to place a releasing incision? Necessary to improve access, a releasing incision should be considered when the mucoperiosteal flap is too small to provide adequate visualization and access. Releasing incision is not directly related, not the reason for releasing incision, not related to the incision. This is a method to maintain position, not a reason for incision. So the correct answer is A. A surgeon is attempting to extract a single rooted tooth with no surgical bone removal. What does the technique of grasping a bit of buccal bone under the buccal beak of the forceps achieve? Achieved by grasping buccal bone, grasping a bit of buccal bone under the buccal beaks of the forceps provides better mechanical advantage and grasping of the tooth root. Achieved by straight elevator, achieved by surgical bone removal, achieved by reflecting a mucoperiosteal flap, achieved by the index finger. So the correct answer is A. A surgeon is using a straight elevator during an open extraction of a single rooted tooth. What is the correct positioning of the surgeon's hand to control the force of the elevator? Ensures control and prevents slippage. The index finger of the surgeon's hand should support the force of the elevator to control movement and prevent slippage. B, C, D, and E are not mentioned in the literature. So the correct answer is A. After reflecting a mucoperiosteal flap and using a small straight elevator, a surgeon successfully luxates a single rooted tooth, which tool is typically used next to complete the extraction. Used for further luxation if needed, used to reflect the flap, typically used to complete the extraction after luxation. After luxating a single rooted tooth, extraction forceps are typically used to complete the extraction. Used for surgical bone removal, not mentioned in the context of a single rooted extraction. So the correct answer is C. Thank you. Wish you best of luck.